Welcome from the studios of KPBS TV in San Diego, California. We are reaching you live through a unique and complex international telecommunications network via satellite, microwave, and cable. The International Training Center at San Diego State University brings us all together in this video conference, which joins distinguished organizations located in Mexico, Cuba, the Dominican Republic, Costa Rica, Panama, Colombia, Venezuela, Peru, Ecuador, Brazil, Bolivia, Paraguay, Argentina, Spain, the United States of America, and the United Nations Conference on Trade and Development in Geneva, Switzerland. Welcome to our program, Integrating Work, Health, and the Environment, your formula for prosperity. This is the 11th video conference in the series, Foundations for Prosperity in the Third Millennium. My name is Dan Hopwood, and I will be your moderator for today's program. I'm a vice president with the international insurance and management consulting firm, Marsh USA, concentrating in the fields of integrated safety and risk management, as well as business continuity planning. Today's video conference is composed of 2 presentation modules and 2 question and answer sessions, and we look forward to your live participation. In today's video conference, you will be hearing from 2 distinguished speakers, each of whom bring a unique perspective concerning the need to develop strategies that enhance the integration of work, health, and the environment. Today's speakers will set the stage for what we, as managers, educators, and employers must consider in the new millennium when considering the integration of these 3 elements. If we are not successful in this integration, the impacts will be widespread. In spite of our collective efforts, events will occur that challenge our philosophies, the health of our workers, and the environment. When these contingencies strike, we all must be capable of invoking plans that address emergency response to outcomes such as violence in the workplace, or plans which maintain the continuity of business operations in the face of labor unrest. Such contingency plans will maximize the distinct considerations discussed by our presenters today. Additionally, these plans will help assure organizations that their operations will be maintained at acceptable levels of performance, while at the same time caring for the health of workers and the tenuous balance of the environment in all we do. It is my pleasure to introduce you to today's expert speakers, Kathlyn Mead and Dr. Richard Lippin. Ms. Kathlyn Mead is the President and Chief Executive Officer of Sharp Health Plan. She has served in this capacity since June 1996. Kathlyn has an extensive background in healthcare from both the plan and provider perspectives. Prior to joining Sharp Health Plan, Kathlyn was Vice President for Managed Care at Children's Hospital and Health Center in San Diego, where she was responsible for all managed care and marketing-related activities. Ms. Mead is extremely active within the San Diego healthcare community, serving on numerous task forces and advisory committees, including Healthy San Diego, the Community Health Improvement Partners, and the School Health Improvement Project. Kathlyn is a member of the Board of Directors of the San Diego Urban League, the Consumer Center for Health Education and Advocacy, and the California Association of Health Plans. She holds a Bachelor of Science in Business Administration from Regis University in Denver, Colorado. Dr. Lippin is the Corporate Medical Director for Lyondell Chemical Company, whose world headquarters is based in Newton Square, Pennsylvania. As Medical Director, he is responsible for the management of occupational and environmental medical programs and issues for Arco Chemical Company on a worldwide basis, including the Americas, Europe, and Asia-Pacific regions. Dr. Lippin serves as chair of the Mental Health Committee of the American College of Occupational and Environmental Medicine. Also, Dr. Lippin was recently appointed to the National Institute of Occupational Safety and Health Research Priority Team which is addressing organization of work issues. Dr. Lippin also serves on the advisory board of the Journal of Occupational Health Psychology and Alternative Therapies in Health and Medicine, and serves on the governing council of the Historic College of Physicians of Philadelphia. Dr. Lippin received his B.S. in biology from Temple University and his M.D. from the Temple University School of Medicine. Welcome, and I would like to start with a question for both of our presenters. Work is used in two contexts in your presentation. One context is how work is the vehicle by which employees are provided goods and services to assist them in maintaining their health. Another context is how work should be that environment, that place, if you will, where a worker receives some of the responsible pleasures in their lives. I'm interested in how these contexts are the same, or if in fact they're different. And Kathlyn, I'd like to throw that question to you first, and maybe you could address the sameness, if you will.
Sure. Of course, Dan. I believe that employees really want to know that their employers believe in them, that their employers are willing to make an investment in them, that they are valued, and that they are appreciated. Employers can demonstrate that in many ways, in addition to salary. Employers that consider health education and promotion in the workplace and promote activities such as healthy lifestyles, education, nutrition, can allow employees to see that the time that they spend in the workplace, employers are interested in what happens to them after the workday, when they go home, that they can take the tools that they learn in the workplace to enhance the quality of their lives at the end of the day.
So we see how some of those contexts then become the same. And now let's shift over to the medical view, Dr. Lippin, and you address that as well.
Yes, thank you, Dan, and I agree with Kathlyn. I think what she said is very important. As a physician, I view this as a continuum. Firstly, work should do no harm. We need safe and healthy workplaces all over the world. Secondly, work should provide for some very basic needs, like income, so that individuals can purchase good health care and obtain other basic needs. And thirdly, and in the best of all worlds, work should be fulfilling. Meaningful and creative work should improve health in the best of all worlds, and that's my goal.
Very good. I like the differentiation between the community setting, the clinical setting, and how they actually do become one. And that's part of what we're going to talk about today. So let us turn now to Module 1. During her presentation, Kathlyn Mead will discuss the critical role the employer plays in integration strategies. Kathlyn will highlight further the relationship amongst work and the community in achieving such successes. The community referred to includes not only those from which workers are recruited, but also includes the larger context of community, both regional and global. What is clear is that the line of demarcation between work, community, and home life is blurring. This effect is not necessarily a bad one. However, it is one which demands that employers recognize their role in managing this dynamic. In part, the lack of distinction between work and home life, for example, is the responsibility of the employer. Thus, the implementation of mitigation strategies often rests with them. One such consideration may be found in the example of telecommuting. In telecommuting, where an individual actually works from home or site remote from an organization's main facility, issues arise about the number of hours worked. In this scenario, the naturally positive effects of taking time off from work are negated by the simple potential that an employee is always on call, or employees do not stop answering their phones or responding to email messages. Kathlyn's comments suggest strongly that the employer must take the lead in empowering employees to manage their lives, while at the same time developing organizational programs that benefit the worker as well as the employer. I think you'll find this very interesting.
Thank you. When we think of the workplace, we don't often consider the impact that the healthcare environment has on the productivity of employees. As business owners, managers, and supervisors, access to affordable, high-quality healthcare for our employees will most likely place a distant second to running our businesses. Currently in the United States, besides the government, businesses primarily serve as indirect purchasers of healthcare for their employees. Although individuals may choose to self-insure or directly purchase a variety of health insurance products, the vast majority of the workforce receives their health insurance benefits through arrangements made by their employer. In order to compete with other businesses, to attract and retain the most talented and productive workforce, employers consider health benefits a necessary expense. Because of the significant financial investment employers are making, it is in their best interest to maintain a keen awareness of all aspects of the healthcare environment and to bring health issues to the attention of their employees. Over the past decade, many have questioned whether employer-sponsored healthcare benefits are the best method of ensuring access to healthcare in the United States. This question has been raised because nearly 25% of the United States workforce does not have access to health care coverage. The uninsured often become the most costly population to serve once health care services are needed. There are many reasons why. First, the uninsured often access health care in a hospital-based emergency room. However, nearly 50% of emergency room visits are not emergent in nature and could have been treated in a less acute setting. Due to the need of a very specialized care in truly emergent situations, emergency rooms can be the most costly healthcare delivery method. Second, the uninsured are typically uneducated about and are not practicing preventive care such as immunizations and healthy lifestyles. Once again, this results in the very high-cost emergency room caregiver to assume the role of primary care provider. Third, due to high cost of emergency room services, the uninsured often wait until late in the course of illness before seeking health care services. Early detection and treatment of disease typically results in a less protracted length of treatment, which in turn lowers the overall health care cost. As the United States faces the new millennium, elected and public health officials and health policymakers will continue to question whether employer-sponsored coverage is preferred over universal coverage models such as those in Canada and Britain. In a 1998 survey comparing access to health care in 5 nations, the results showed that in none of the nations were healthcare consumers completely satisfied with the healthcare they receive. Studies of this type are important for countries developing and considering healthcare delivery models and financing of these systems. However, it is becoming clear that different problems result from different delivery models, and that no healthcare delivery and financing model can currently be held up as a panacea. During today's teleconference, I intend to discuss the importance of employer involvement in offering healthcare coverage for their employees. I believe it is of equal value for employers to actively promote health education, wellness, and prevention activities in the workplace. And finally, I hope to show the value of employers joining health policy and public health officials in their communities in identifying and prioritizing health issues and developing plans to address these issues. First, let me introduce you to a very successful community-based health issues assessment process that has developed in San Diego, California. For the past few years, a number of healthcare stakeholders have come together to assess the healthcare needs of the community. Through the Community Health Improvement Partners Collaborative, also known as CHIP, San Diego has prioritized its community concerns surrounding healthcare issues. Many might be surprised at what CHIP has learned. Healthcare issues such as substance abuse, mental health, and violence ranked highest among age groups within the working range. The CHIP Health Needs Assessment is a model that communities can use to help identify and begin to address health care issues. Employers should be especially interested in an assessment of this type because of the overall impact that untreated health issues have on the workplace. As purchasers and consumers, employers are acutely aware of the high cost, both business and financial, of communicable disease such as influenza, chronic disease such as asthma, and catastrophic disease such as cancer. However, are they aware of costs associated with health issues such as substance abuse, mental health, and violence? The CHIP Needs Assessment Committee identified 12 health issues and prioritized them within 4 age groups. They utilized a priority-setting model developed by John J. Hanlon using the following criteria. Size of the problem, that is, the incidence and prevalence per 100,000 population. The seriousness of the problem, which included case fatality rates, years of productive life lost, and the impact on the quality of life, economic costs, and the social impact. And finally, community concern, which was established through a community survey. In a series of 3 meetings with broad community participation, health issues by age group were voted upon. What emerged from the scoring of health issues was a trend between certain age categories. As a community employer, it might be interesting to attempt to assess the overall impact on the workplace that results from the top 3 of these issues: substance abuse, mental health, and violence and abusive behavior. Since the majority of workers fall into the age 24 to 65 category, and many of these workers are likely to become parents of children who will enter the workforce, it can be of great value for employers to involve themselves in resolving these community health concerns. Let's first look at substance abuse. The needs assessment defines substance abuse in 3 major categories: tobacco, alcohol, and drugs. 2 important workplace factors to consider regarding tobacco use are that 1, according to the Centers for Disease Control, tobacco use is the leading preventable cause of death in the United States. And 2, cigarette smoking is the most alterable risk factor. In the United States, 400,000 deaths per year can be attributed to tobacco use. Tobacco products account for nearly 1/3 of all cancer-related deaths. Because employers predominantly bear the cost of health insurance for their employees, they are most likely aware of the high costs associated with treating smoking-related cancers. However, how can employers influence the consequences of tobacco use that receives less media attention? One way is through consistent and thorough communication to employees regarding their personal responsibility for living healthy lifestyles. Smoking is a key risk factor for respiratory illness. Most likely, employers don't track the number of times employees are out ill with respiratory illnesses such as asthma, bronchitis, or pneumonia. They probably don't trend the number of times employees miss work to care for a child or other family member with a respiratory illness. Children with parents who smoke at least 10 cigarettes a day are twice as likely to develop asthma as those parents who do not. Many children may also be cared for in a daycare home where the provider may also be a smoker. Making information such as this available to employees will arm them and empower them to use and consider this information when looking at their own lifestyles. While many employers do not allow smoking in their building, they might also want to develop and offer programs that discourage smoking at home as well. Employers might also want to adopt programs that assist parents in selecting daycare providers for their children from those that do not smoke. Second, we'll look at alcohol abuse, which is another critical health care issue that may have a significant impact on the workplace. While many fewer deaths can be attributed to alcohol abuse than tobacco use, the incidence of traffic fatalities and other unintentional deaths related to alcohol abuse are high. 44% of traffic fatalities, which include boating and aviation accidents, can be related to alcohol abuse. However, 50% of alcohol-related traffic accidents do not result in death, but instead they result in chronic and disabling conditions. Employers who lose productivity in their workforce due to the necessary need for treatment following an accident, or whose employees can no longer perform at the same pre-accident level of productivity, are paying the price of alcohol abuse. Now, let's consider for a moment the indirect impact of alcohol abuse in the workplace. Employers should realize that alcohol abuse is more prevalent in children that come from families where alcohol is used. Children of alcoholics display more symptoms of anxiety and depression. Children of alcoholics tend to have more difficulties in school and score lower on verbal ability tests. When we looked at tobacco-related costs, we identified missed days on the job related to caring for family members. Employers may also experience significant time off work related to increased appointments with teachers and counselors regarding the behavior and associated learning difficulties that manifest themselves in these children. What's more, perhaps parents on the job are worried that their teenage children may be abusing alcohol after school. This parental anxiety leads to lower work productivity. That leads us to a discussion about drug abuse. Drug-related emergency room visits have reached an all-time high in the United States. 14% of adults aged 18 to 25 reported using illicit drugs. Drug use causes a number of health-related problems, including brain seizures, cardiac malfunctions, and birth defects. And, as previously mentioned, employers are paying the price for abuse of drugs, since it is estimated that in the United States, over $70 billion annually can be attributed to wasted productivity. Employers have a very real incentive to educate and offer access to treatment for their employees with drug addictions. The substance abuse-related categories are extremely preventable in the workplace. Zero-tolerance programs can be established and used as a deterrent for modifying employee behavior. In addition, employee education and health promotion programs can be brought in-house as a method by which employers can demonstrate their interest and concern about these workplace health care issues. The mental health of employees should be of critical importance to employers. Mental health can be partially defined as the ability of an individual to negotiate the daily challenges of life. For full-time employees, approximately 50% of their daily lives take place in the work environment. Common disorders such as anxiety may affect a large percentage of the workforce. Employees who feel anxious much of the time will almost inevitably have an impact on their coworkers' morale and productivity. It has been determined that 1 in 6 of all people in the United States will experience depression during their lifetime. And women are twice as likely to suffer from depression than men. It is important to remember that in the United States, the workplace is now nearly made up of 50% female employees. Interestingly, while most large employers in the United States offer health care benefits to their employees, they don't often devote the same time to the development of mental health benefit designs as they do to physical health benefit designs. Often, employer costs related to mental health-related diagnoses can be attributed to short and long-term disability. These costs cannot be measured in the disability insurance premiums alone. Costs associated with hiring and training replacement employees must also be considered. Early identification and treatment of mental health disorders can drastically reduce expense associated with short and long-term disability. To bring this discussion full circle with our previous substance abuse topic, you might find it interesting to note that depression is a leading cause of alcohol and drug abuse and other addictions. It is also of critical importance to note that 80% of depression cases can be treated. Many employers have determined that employee assistance programs may be one way to identify and treat mental health concerns among their employees. Employee assistance programs are often easily available to employees, and while their benefits are usually limited, trained mental health providers can offer long-term solutions to include wrapping around other employer-sponsored benefit health care plans or community-based services. Physical and emotional abuse can also play a significant role in the productivity of employees. In the United States, women are particularly susceptible to violent and abusive behavior. Approximately 70% of men who abuse their spouses also abuse their children. Psychological trauma results in victims of physical and emotional abuse. Every day, each of us may be working with someone who is an abuse victim and may be impaired in a variety of ways. These victims may be fearful, anxious, or isolated. Victims of violent and abusive behavior are often absent from work. Some come to work and, in turn, verbally and emotionally abuse their coworkers. In the United States, businesses are becoming more aware of violence in the workplace because of the fatal consequences resulting from the use of firearms in the workplace. Security and safety on the job has become paramount to employees. Violent and abusive behavior in the workplace can be detected and treated. The role of the employer can be to ensure that their employees have access to programs that help manage and change these types of behaviors. As an employer and a health plan administrator, I am convinced that as employers, we have only begun to scratch the surface when making contributions to the health and welfare of our employees.